Hi friends, in this video we'll be learning about glucose transporters involved in the transport of glucose and various clinical disorders associated with digestion and absorption of carbohydrates, as well as some inhibitors of carbohydrates and about dietary fibers. So these are the glucose transporters: GLUT1, GLUT2, GLUT3, GLUT4 and GLUT5. The organ presence are: for GLUT1, it is present in blood, blood-brain barrier and heart. This glucose transporter is insulin independent. GLUT2 is present in liver, pancreas and small intestine. This glucose transporter is insulin independent. It has a high Km value and low affinity. GLUT3 is present in brain, neurons and sperm. It is insulin independent. It has low Km value and high affinity. GLUT4 is present in skeletal muscles, adipose tissues and heart. Absorption of galactose is similar to glucose. Fluorescein, it is a drug which inhibits sodium dependent glucose and galactose absorption in intestine and renal tubule and thereby causes renal glycosuria. Fructose does not dependent on sodium for the absorption. It is transported by facilitated diffusion with the help of specific carrier. Pentose is absorbed by simple diffusion. Some clinical disorders: lactose intolerance. We have primary congenital lactose intolerant, secondary acquired lactose intolerant. The enzyme deficiency is lactase. Undigested lactose is accumulated in the intestinal lumen. Undigested lactose in the lumen absorbs water from the enterocytes. That phenomenon is called osmosis and leads to diarrhea. Intestinal bacteria acting on the undigested lactose and leads flatulence. What are the clinical symptoms? Abdominal pain, flatulence, diarrhea. How do you treat? Lactose must be avoided. So you can replace it with soybean milk. Curd, lactobacillus containing lactase. Yeast is also containing lactase. So you can replace it with soybean milk. You can give curd which has a lactase. You can take yeast also which has a lactase which helps for the digestion of lactose. Disaccharidases deficiency like sucrase, maltase, isomaltase and lactase leads to disaccharidases deficiency. Non-digestible carbohydrates are dietary fibers. They are not digested and they form bulk of the feces. Example: cellulose, hemicellulose, pectin, lignin, gums, etc. What is the importance of dietary fiber? It is a non-digestible carbohydrate. It is an important dietary fiber. It forms bulk of the feces, prevents constipation, prevents colon cancer, reduces absorption of glucose, reduces cholesterol level in the blood. That's all about digestion and absorption of carbohydrates. Thank you friends.